Hello, everybody. Today I'm going to be doing a career interview with my husband, Matthew, who is currently a nurse practitioner who specializes in endocrinology. And we're going to talk about how he came to be an NP, um, and kind of background on why he chose the career he chose. So, Matthew, why did you choose to be an NP? How did you get to this spot?
Sure. So interestingly, we actually have quite a few healthcare professionals in our family, including a pharmacist. And I originally was gonna consider becoming a pharmacist, but along the way, I did not enjoy chemistry, and I was at St. John Fisher for undergrad and had some amazing faculty and a great service scholarship. And I said, you know what? I'm going to go into the world of nursing. So I did get my undergrad in nursing, did a lot of clinical work at Strong. And subsequently from there, I went right into a master's program. So I always knew that the ability to assess, diagnose, treat, and manage at an advanced practice level was where my interests were as a clinician. So I got my master's at Lemoyne. And from there, things kind of blossomed. I specialized in urology for about 2.5 years in uro oncology. So I did a lot of GU cancer work. And through that, I would take care of a lot of immunotherapy patients and giving them immunotherapy drugs and study infusions. And as a result, a lot of endocrine conditions started to arise with side effects. And I really started to dive deep into that with my specialty. And subsequently, an opportunity at Krause opened up, and this is where I landed. So I ended up joining Krause as an endocrinology provider.
Great. Would you say there is like a specific person that you admired throughout your childhood or something that led you to this career?
Yeah, I mean, I wouldn't say necessarily my childhood, but there are two faculty members at Fisher um, who I've become very close with. One, she's actually a PhD with exercise physiology, and she taught my undergrad anatomy and physiology course. And then another faculty member who's actually a chiropractor, but also teaches nutrition, anatomy, physiology. And we ended up becoming really close friends, and funny that both of them were just at our wedding here in November. So they have been very close mentors, friends of mine, really pushed me to succeed. Felt that I would be a great candidate to go to medical school, but obviously life happens, and here we are today. So really, I had two great faculty members in my undergrad work that really said, "Hey, you have the potential to become something great. You have the knowledge, the compassion, um, really the dedication, um, and really, really pushed me to uh, endless opportunities. And this is where we are today.
Would you say that you have some similarities to these professors?
Yeah, absolutely. I would say that the passion to want to know why in our work and what we do. So this was what, when I started to do clinical research and an interest in this, also teaching. That's why right now I'm getting my master's in nutrition. I've been looking at doctoral programs to teach, such as with my DNP potentially. We have a passion to grow science and knowledge. And I think doing that, I did do a lot of TA work with them in the anatomy and physiology department specifically, and that was really a great experience with them. So I would say um, their their passion for the work ethic, their knowledge, the continuous wanting to grow in our profession um, really shows through. And so that's why I would say that yes, absolutely.
Well, leading into that, is there like a specific magazine that you read regularly or a TV show that you have a favorite of that you enjoy?
Yeah, I mean, it's kind of interesting to watch The Good Doctor, or our series of, um, The Resident, or even Grey's Anatomy. And you sit back and watch some of these medical shows and you nitpick and be like, well, this doesn't make sense, or this is absolutely stupid, or this really doesn't happen in real life. So I think sometimes, reality and what we do in healthcare and what is portrayed are two different things. Sometimes there's a lot of misnomers about that. But from an academic standpoint, I do use a lot of like up to date. I do have the NPA journal through the Nurse Practitioner Association, so we will read through that. Some of the GU oncology literature updates. Obviously, we get usually a journal once a month in our mail. That you probably think is a paperweight, but I don't know. But yes, anyway, I do try to keep as up to date, and I think sometimes to de-stress in our work, we watch these medical shows and we can laugh. And Because honestly, some people really think what we do and that's reality when it isn't.
Great. So, going off of that, would you say that what would you say your all-time favorite story from either a book or a movie is?
Hmm.
And if there is it any book or story that kind of led you on your career path?
I mean, maybe not necessarily um, a specific book or movie, I would say. I mean, I think that along um, along the journey itself, um, I think even before I started taking my nursing coursework, some of the texts that we had to read and some of our, English courses, or specifically with a faculty member by the name of Jason Berman, who taught organizational leadership. There was one specific book that looked at different conceptualizations in organizational leadership that kind of built my foundation. The concept of the Johari window, um, which you may actually um, um, use in clinical practice and mental health counseling as well. But I do think that specifically, um, that would probably be one of the books that I remember on creating habits and organizational leadership. So that's what I would say there.
Do you have any hobbies or activities you enjoy doing in your free time?
Yeah, absolutely. With my dogs Kramer and Lila, both which are rescues. One's a lab wired hair terrier. That's Kramer, and our lab healer Lila. She's the puppy now. Like I said, both rescues. We spend a lot of time with them, and I enjoy spending time with them. Um, I like to read, um, and really hobbies include trying to go to Costco at least once a week, and yeah.
Um, is there a favorite motto or saying that you like to live by or like hearing?
Hmm. Yeah, that's kind of interesting. Um, in healthcare, um, as you know, burnout is a big component to this, especially in young clinicians. We are also seeing this, and in my prior role where I would see 26 or 28 patients a day, and really working 12, 14-hour days, and constantly having to try to catch up on my notes in this repetitious cycle. I did turn to um, really looking at um, motivational, like, presenters and speakers, and different components to that. And I'm just trying to see. there was a specific couple of quotes that I think really kind of hit home. I will say that Golda Meir has a quote that says, "Trust yourself and turn your inner sparks of um, achievement into growth." I do think that she really kind of turned your inner sparks of possibility into flames of achievement, were the exact words. Um, and I really hone in on that. Um, and because there are so many possibilities and so many different things that we can do with our careers and who we become, and our work is, a major component of our lives. Um, so I would say um, probably that one. And I think also the Basilian Fathers have this instilled in us of teaching me goodness, discipline, and knowledge, and that will always be ingrained in my work. Um, and then also with my patients, one important factor is patients first. So, with our healthcare system and the way things are, and insurance companies, as we've seen with major issues and kind of unfortunately leading to how us clinicians should be prescribing and or treatment options for a patient that we feel is best, but insurances don't want to cover that. Um, it's very difficult, but at the end of the day, ethically, it's always put the patient first.
Great. So the next two questions you might find a little weird or out of place, but a focus of my interview is trying to look at patterns of why people chose the careers that they chose. So the next question is, what were your three favorite subjects in junior high school and high school?
Yeah, absolutely. So band was one of them. Also, I was a New Vision student, so I was in the New Vision's medical professions. So I used to take classes up at the hospital, and did like human anatomy and physiology. So those courses and the sciences, I really hated English and history. But yeah,
Why would you say that you enjoyed those classes?
yeah, I think it's the curiosity and connecting the dots to things, understanding physiological processes, because you really have to have a strong foundation of anatomy and physiology, for example. To obviously be a clinician, you have to understand how the system works before you can treat a condition and what happens in a physiological response. Um, and I would say, that's as to why um, that I really liked science. I thought it was fascinating. Um, to understand chemistry and biology. Um, and so, yeah, I would say that's another reason.
Why would you say you hate English and history?
Yeah, I mean, I just found them to be very boring. I didn't have that attention to want to really focus in those areas. I don't necessarily know why, but I just was like, well, no, this is not my thing. Um, and that's why I really just preferred the sciences and the maths more than I did the English and the history for sure. I just didn't find it that it sparked an interest in me, and I didn't really want to learn more of it unless I absolutely had to. But yeah,
So this is the last question, and this one goes a little further back than high school. But what are three stories your earliest recollections, preferably between the ages of 3 and 6 years old, if you can remember that far back?
just three stories in general
Mhm.
related to my profession. Like why?
Just the three stories, three of your earliest recollections.
Um, I mean, I guess One of them would be November 3rd, 1999. I had major reconstructive leg surgery because I had Blount's disease. So that was a journey for pretty much numerous years of my life. Um, I would say another would be obviously the my parents getting divorced, um, and kind of going through that process um, was quite a lot. And then um, really it would be just like going through school and all the marching band experiences that I mean I still remember, and building those
Yeah.
friendships and having those connections.
Your trip to Italy?
And our trip to Italy, that was really I had when I was young I went to Italy, and I think it was 2008 or 2009. Went for a month with my grandparents. um but that kind of those are the things, and obviously the accomplishments of getting into New Visions in high school, and then getting into Fisher for college, and kind of doing all that on my own. So there's a lot of memories associated with that as well.
Great. Well, I want to thank you for answering my questions today and helping me out with this project. Is there anything else you want to add?
No, I think we really kind of touched on all of the components, and I think that in our line of work as medical clinicians, we also do, and I could say, support the mental health profession, and big proponents of mental health, and with a lot of my patients, for example, who are dealing with diabetes management and the biopsychosocial approach, and looking at what's going on in individuals' lives. um, I can tell you that during the pandemic, even when I was working in urology, I was doing more primary care, it seemed like, and was a mental health support. And I will tell you that, um, you know, we definitely need more mental health counselors and support, and a big proponent of it in my clinical practice, and encourage um, brain health.
Yeah. Well, thank you again, and thank you everybody for listening.